Hey everyone, and welcome back to MedCore Academy. Today, we're breaking down the exam for cranial nerve 8, the vestibulocochlear nerve. This nerve has two jobs, hearing and balance. First, let's test hearing. A simple whisper test, where you whisper numbers from a few feet away, is a great start. We also use tuning forks. The rinne test compares hearing through the air versus bone, right behind the ear. Air conduction should be better. The Weber test, with the fork on the forehead, checks if the sound is equal in both ears. Next, we check balance, the vestibular part. We watch how someone walks and if they can march in place with their eyes closed without drifting. We also look for nystagmus, which is involuntary eye jerking, especially with quick head turns, like in the head impulse test. An abnormal result can point to issues like hearing loss or vertigo. For more deep dives into clinical skills, make sure you subscribe. Thanks for watching.